My name is Maribel Nzegu. I'm a senior staff attorney at ChangeLab Solutions, and I'd like to welcome you to part 2 of our 2-part webinar series. It's called Tackling Tobacco in California, and it's presented by ChangeLab Solutions and the American Lung Association Center for Tobacco Policy and Organizing. Before we begin, I'd like to remind everyone that you can use the chat box to submit questions to me and the other presenters. You can submit questions at any time, and we will answer as many as possible during the Q&A session at the end of the webinar. So, part 1 of this webinar series covered California's new restrictions on tobacco retail sales. And an archived recording of that webinar is available on our website, and part 2 will be emailed to all registered participants in the near future as well. So today we'll be discussing 3 new California laws regulating tobacco use, which were signed into law this year on May 4th and went into effect on June 9th. The new laws addressing electronic smoking devices, smoke-free workplaces, and smoke-free schools are helping us move closer to 100% smoke-free air. We will also highlight the actions that local jurisdictions can take to move us even closer to our goal of smoke-free air. As I mentioned, I'm a lawyer, so I'll do something lawyerly to prove it. I just need to let you know that all the information presented today is for informational purposes only. At ChangeLab Solutions, we don't offer legal advice or enter into attorney-client relationships. So while I am a lawyer, I am not your lawyer. ChangeLab Solutions is a nonprofit located in Oakland, California, and our mission is to create innovative laws and policies to ensure everyday health for everybody. We work toward this mission in a variety of different areas that can improve our communities. A few of these are housing, child care, transportation, public safety, and of course, tobacco control, which is what we're talking about today. So here's our agenda for today. First, you will hear an overview of 3 new tobacco laws that regulate electronic smoking devices, smoke-free workplaces, and smoke-free schools. I'm seeing that some folks are not able to hear me. Can everyone hear me now? Can you just type into the chat box if you can hear me? Okay, great. Thank you. So again, moving on to our agenda, we'll be covering electronic smoking devices, smoke-free workplaces, and smoke-free schools. You'll hear about California's experiences implementing the new laws to date, and this will be followed by organizing and messaging strategies for local efforts. We'll conclude with a question and answer session, so please send us your questions as we move through the webinar today. Here are your presenters. I'll get things rolling by covering how the new laws incorporate electronic smoking devices. Next, Diana Douglas of the American Lung Association will cover smoke-free workplaces and schools. Tanya Hageman will then share insights from the California Tobacco Control Program's experience implementing these laws. And finally, Erin Reynoso from the American Lung Association in California Center for Tobacco Policy and Organizing will discuss organizing and messaging strategies for local tobacco control efforts. My colleague, Ray Leung, will moderate the Q&A session at the end. Let's begin. So, while my colleague Derek Carr covered tobacco products in the first webinar, it's a good place to start and provides a great refresher. So under California law, the term tobacco products now includes traditional tobacco products such as cigarettes, cigars, pipe tobacco, roll-your-own tobacco, and smokeless tobacco. It also includes novel tobacco products such as nicotine gels, nicotine sprays, and dissolvable tobacco products like camel orbs. Tobacco products also include any component, part, or accessory of a tobacco product, whether or not sold separately. These can include rolling papers, tobacco pipes, etc. And it's important to remember this, that tobacco products also includes all of the separate parts of the different products. Under the new law, the term tobacco products also includes electronic smoking devices. This means that devices such as e-cigarettes, e-hookahs, and electronic pipes, to name a few, are considered tobacco products. One of the most important elements of this change that you should keep in mind is that even electronic smoking devices that do not contain nicotine are still considered tobacco products. I'll say that again. To be considered a tobacco product, the electronic smoking device does not have to contain nicotine. We also need to keep in mind when we're talking about electronic smoking devices, as I mentioned earlier, that tobacco products includes the components and parts of electronic devices. And so this would include the atomizers, batteries, e-liquids, and other parts of electronic smoking devices, even if sold separately. Both the devices and their component parts are considered tobacco products. So what's not included as a tobacco product? California law specifically excludes FDA-approved tobacco cessation products used for what's known as nicotine replacement therapy, or NRT for short. Examples of FDA-approved NRT products are nicotine patches, Nicorette gum, and nicotine lozenges. While we may hear anecdotally that people attempt to use electronic smoking devices as a way to wean themselves off of traditional cigarettes, we're actually aware of no studies that demonstrate e-cigarettes are effective cessation tools. And in light of this, it's important for me to state emphatically that the FDA has not approved any electronic smoking device as a smoking cessation product. Again, there are no FDA-approved electronic smoking devices for nicotine replacement therapy. Excuse me. So, while the previous slides were a bit of review since we covered them in our last webinar, we're now moving into exciting new information. For reference, California's smoke-free workplace law can be found in Labor Code Section 6404.5. The state law now defines smoking to include the use of electronic smoking devices. This means that now California's prohibition against smoking also bans the use of e-cigarettes in areas covered by the smoke-free workplace law. And since marijuana is a hot topic these days, I'll also mention that smoking marijuana is prohibited in any place smoking is prohibited under state law. It's important to remember that even electronic smoking devices that don't contain nicotine cannot be smoked in these areas. There's a very strong enforcement rationale for this across-the-board ban, since it's impossible to verify on the spot whether or not a device contains nicotine. Also important to keep in mind is that the state law prohibition on smoking doesn't provide an exception for FDA-approved tobacco cessation products. As I mentioned earlier, there is no electronic smoking device out there that's been approved by the FDA for cessation purposes. But my point is that even if this happens at some point in the future, using those devices in smoke-free areas would still be prohibited under state law. So I just discussed a little bit about how the updates to the Labor Code now include electronic smoking devices in the definitions of tobacco products and smoking. And the changes also apply to schools, and Diana will be covering this in more detail shortly. So now that we understand how California has modernized its smoke-free air laws to include electronic smoking devices, what does all of this mean for local tobacco control efforts? I hear you asking, should my community still adopt or amend a local smoke-free law? And the answer is an emphatic yes. Don't worry, you're not alone in asking this. We hear this question quite a bit. And we know that a lot of policy makers, too, are specifically asking this question. So the new laws are an important first step, but there is still a vital role for local laws to play in protecting public health. And this is because while the new laws expand the coverage of state law to electronic smoking devices, the changes do not automatically include electronic smoking devices in local smoke-free air laws. So for this reason, we still need local laws that specifically cover electronic smoking devices. The state law still has exceptions, and it doesn't even cover outdoor areas. Let's use this visual to demonstrate. In this scene, state law already covers the building because it is an enclosed area. But the outside area, this park, doesn't have to be smoke-free under state law. The only way to make the outside area is smoke-free is to adopt a local law. So again, the building is covered by state law because it is a workplace and it is an enclosed area. However, state law does not extend to the outdoor area, and the only way to make the outdoor area smoke-free is to adopt a local law. The problem right now is that if the local law only prohibits traditional smoking, then people are going to be able to use electronic smoking devices in the outside area. This creates an awkward gap. You'll have a state law that includes electronic devices, but the law doesn't apply to this outdoor area. And you'll have a local law that applies to this outdoor area, but it doesn't include electronic smoking devices. The result is that it's not going to be a comprehensive smoke-free policy. So I just used this one example to explain why policymakers still need to act at the local level, and specifically, they need to include electronic smoking devices in their definition of smoking. This will help expand protections against secondhand smoke to areas not covered by the state law. Again, Diana will be going into a lot more detail about those areas next. So I would like to conclude by saying that ChangeLab Solutions has a few resources that can help California cities and counties draft strong local laws limiting unwanted smoke and unwanted exposure to secondhand smoke. Our comprehensive smoke-free places ordinance and the model smoke-free housing ordinance will help you close all of the gaps in state law. You can also download our checklists, which highlight the key policy options that are available. So thank you. That concludes my presentation, and I'm going to hand it off to Diana Douglas to cover smoke-free workplaces and smoke-free schools.
Thanks, Mary Bell. This is Diana Douglas. I'm the Tobacco Policy Analyst for the American Lung Association Center for Tobacco Policy and Organizing. The center provides training, technical assistance, community organizing assistance, and policy analysis statewide. Today, I'm going to talk a little more about the two bills that Mary Bell had mentioned that were recently passed and have gone into effect. The first bill we'll talk about is the Smoke-Free Workplaces bill that has helped to drastically reduce a number of exemptions to the laws prohibiting smoking in indoor places of work. The second bill we'll talk about is the Smoke-Free Schools bill that will prohibit smoking on school campuses. Under the new Smoke-Free Workplaces legislation, several existing loopholes have been closed that previously allowed smoking in certain indoor workplaces. Prior to the legislation, smoking was allowed at owner-operator businesses where the owner was the sole employee, and in certain small workplaces with fewer than 5 employees. Both of those loopholes are now closed with the new bill. Also, employees will no longer be able to have designated smoking break rooms regardless of ventilation or any other circumstances. There will be no smoking break rooms allowed. The new law also affects where smoking is allowed in hotels and motels. All hotel lobbies and banquet rooms must now be smoke-free. Additionally, the percentage of guest rooms that may allow smoking has been reduced from 65 to 20% of all rooms. And the new law has also banned smoking in covered parking garages. Finally, remember that all of these prohibitions on workplace smoking also apply to e-cigarettes, as Mary Bell had mentioned. So any of these places where smoking is now prohibited in indoor workspaces, e-cigarettes are prohibited as well. Unfortunately, despite the new legislation, some exemptions remain that allow smoking in a few select workplaces. For example, smoking is allowed in retail or wholesale tobacco shops provided certain conditions are met, such as no food or beverages being sold, and if the main purpose of the shop is selling tobacco products. Smoking is also allowed in designated areas of long-term health facilities, in truck cabs, and in some circumstances in theater productions, if certain circumstances are met. Also, it's important for communities to note that many outdoor work sites are unaffected by this new legislation. There are no state-level bans on smoking in outdoor dining areas or at outdoor work sites, so workers in those settings may still be exposed to harmful secondhand smoke if their local ordinances don't go further than these state laws. Next, I'd like to talk a little bit more about the Smoke-Free School bill that also passed. Prior to this recent legislation, there was no statewide requirement for schools to be tobacco-free. Tobacco-free status has always been linked to TUPE funding, and only select schools that received the funding were required to maintain tobacco-free campuses. This meant that only about 50% of local education agencies were obligated to be entirely tobacco-free. Additionally, charter schools were excluded from the funding and had no obligation to be tobacco-free. Under the new bill, the State Department of Education will require that all schools are 100% tobacco-free. Tobacco-free status will no longer be tied to funding and will now apply across the board. Charter schools will also be included. And it's important to note that the bill prohibits not only cigarettes, but also chew, snus, and electronic cigarettes as well. Next, I'd like to take a closer look at which specific school-related locations are now required to be tobacco-free. First, all Department of Education school campuses, including charter schools, must be tobacco-free. This prohibition extends to school grounds, courtyards, and parking lots as well. The tobacco ban includes all school district-owned property or leased property. Finally, smoking is also prohibited within any vehicles owned by the schools, regardless of whether school children are present or not. I hope that this has helped clarify some of the areas that have been established as smoke and tobacco-free as part of the bills that were recently signed this summer. Next, I'd like to turn it over to Tanya Hageman with the California Tobacco Control Program. She is going to go over some of the implementation and logistics of the new bills.
Thanks, Diana. Hi, everybody. I wanted to let you know a little bit about what the California Tobacco Control Program is doing to implement some of these new laws. And I'd like to take a moment, first of all, to celebrate with you, tobacco control colleagues. These laws were really the first major tobacco control smoke-free legislation that came into play since 1998 when smoke-free bars was implemented after smoke-free workplaces was first passed in 1995. So this is a pretty major deal for us, and we should be really proud and happy that this has happened. It's a major step forward, and Closing some of these major exemptions is going to protect a lot more Californians from secondhand smoke, which is a big, will have a big impact on our work. So we should take a moment to celebrate that. We like to say that we're America's non-smoking section, so it's getting even better than it was before. So the clean indoor air laws, as has been remarked, now includes e-cigarettes, which has become a really big issue for us in California. What we're understanding from national colleagues is in a lot of other states it's not quite having as big an impact as it is here and in a few other select states. But here in California we definitely have seen the impact, and we are taking steps forward to make sure that we're protecting the public from e-cigarette aerosol as well as secondhand smoke. The exemptions that were closed were big exemptions, and they're going to have a major factor in protecting a lot of people in the state. There are a few areas where we can still improve, so we do want to be looking at those as possible options for our work going forward. But we have taken some big strides this year, and that's really exciting. One of the major things that we here at the Tobacco Control Program we're very happy about, the Centers for Disease Control and Prevention in Atlanta, even though we were really the first smoke-free state, we were, because of the exemptions that we had, we were not acknowledged as an official smoke-free state by the CDC. And with the closing of these loopholes, we are now officially a smoke-free state, which we're really proud to join that illustrative group of other states. So what has the state of California been doing to help implement these new laws? We wanted to make sure that you guys are aware of all of the things, trying to educate the public, one, about the new laws and about the need to comply with the new laws, and how they do that is really important whenever there's any new policy passed, as all of you are aware. And these were pretty big changes, so we wanted to make sure we got the word out. So we have been implementing a very large e-cigarette advertising campaign and some media resources that I think you probably have all seen, but I'll give you a little peek at those and let you know what's coming down the pike. We also have created a fact sheet for employers on the new laws with help from our colleagues who are on the line. And we have an infographic that can help educate the public about what the new laws are and what the exemptions are and what's happening as far as closing those and what's left. We have a comprehensive secondhand smoke brochure in the works that rather than trying to educate the public very piecemeal, we have a lot of great examples of a smoke-free parks piece or a smoke-free workplace piece. Lots of different segmented portions, but we felt it was time with closing these exemptions to have a brand new educational piece that showcases California comprehensively, really letting people know that we are a smoke-free state and these are all of the laws that apply to that. So we're getting that through our approval process, and it's very exciting. It's going to be great to share with you. I think it'll be very helpful in community work. And we also have a frequently asked questions document, because whenever legislation is passed, legislative language can be really complicated, and so there's lots of questions about how to comply with the law, specific situations that people are curious about, and we want to be able to answer those questions for the public who are trying to comply with these new laws. So that is in the final approval stages as well. So let me just run through quickly what we've got going in all of these areas and show you what they look like so you know how and where to find them. So e-cigarettes, our advertising campaign, I think a lot of you have seen, if you watched the Olympics, you saw a lot of our television ad campaign. We have a great television ad that was airing during that time. We also have DJ reads in certain communities across the state where on radio stations a DJ may get on and talk about this message is brought to you to say that e-cigarette is not vapor, it's toxic, those kinds of messages. So that's been really helpful in getting some messages across through a little bit different means in the media. We do have some radio ads that are going to be airing in September starting this week. So you'll be listening for those. That is a statewide radio campaign. and it's some interviews with teens on e-cigarettes and their use of e-cigarettes. So those are beginning to air this week, and then we also are planning to have those interviews, segments of them on YouTube. So we'll be getting some information out about that so people can actually visually see these teens talking with the interviewer about e-cigarettes. We also have a current bus shelter and bus side campaign going on. You can see those ads on the right. Those may look familiar if you see buses going around your community. And we do have our website, Still Blowing Smoke and Tobacco Free CA, where these materials and media materials can be found and links to lots of information that's connected with those campaigns. The Smoke-Free Workplaces Fact Sheet is a document that really is targeting employers and owner-operated businesses to let them know about the new law, what is included, how they can best comply. It's written in simple language. It's much easier to understand than the legislative language. And it's a very helpful document to be able to take out to business owners in the community and educate them and just let them know this is information that you as a business owner need to know about what's happening in the workplace with regard to secondhand smoke. Our infographic is a comprehensive piece that really shows what the clean indoor air laws now include, all of the places that smoking is prohibited, and what's included in the products in the law. So this is a full page. I can only get part of it on the slide, but it is available on our website, CDPH, and also on the partners website. Again, a nice piece to be able to take out to business owners, to the public, to make available at health fairs, taking it out to lots of different areas in the community to help educate. So the comprehensive secondhand smoke brochure, as I let you know, is a piece we are in development with, and we hope to get that out within the next month. And our frequently asked questions is very close to being ready for posting, so we're just clarifying a couple of last points on that, but that should be ready in the very, very near future. And it will be posted on our public website. So here's where the links are in case people are looking for those, and you can use through the webinar to find that, or you can feel free to contact us here at the California Tobacco Control Program. We can point you in the right direction. I also wanted to let you know about a few other things that are in the works as far as education and enforcement. We get a lot of questions, being the newest information, being the newest laws to come out around smoke-free areas since 1995. There are a lot of questions about enforcement and who's enforcing these laws, who's responsible for that. And communities are talking to us and letting us know that there needs to be some clarification and some ways to have discussions with law enforcement about how best to approach enforcing these laws. So we have a toolkit, we call it the Law Enforcement Roundtable Toolkit, that was developed originally for sales to minors. We're in the process of revamping that toolkit and adding in some information about smoke-free jurisdictions and areas and how to talk with law enforcement about enforcement of those laws. So that update is in the works. We plan to have a webinar at the end of November that will showcase that updated toolkit and let people talk about some of the issues that they've had and how they've been problem solving some of those enforcement issues. And then, like I said, we've surveyed lots of local projects that are working in tobacco control, and we've been talking with them, calling them up, hearing from them about the challenges that are being felt, and so that's part of what we're going to be addressing on that November webinar. And finally, a lot of people are very curious about tobacco-free schools, and we've been talking a lot with our wonderful colleagues at the California Department of Education. And the Tobacco-Free Schools Law really falls into their purview for implementation. And they have been really hard at work to try and get information out to schools, to teachers, to principals, to superintendents, to charter schools, to district offices about this new law and what needs to be done at the local level to help implement tobacco-free schools. They also have been communicating a lot, trying to get this word out in any way possible. So they have sent a letter out with the beginning of the school year to county offices of education, district superintendents, and charter school administrators. And they have a frequently asked questions document as well on the tobacco-free schools and implementation. So that information has gone out. And they are in the process of getting that information up on their website, the California Department of Education, and making that more available for others to be able to use and help transmit that information locally. So we'll make sure that we can provide links to that as well as soon as that is available on that website. They also are in the process of revamping a tobacco-free campus toolkit that was developed, and taking a look at that in light of the new law and making that available for schools to use in looking at their campuses and how to make them tobacco-free and make sure that the law is followed. And they also are planning a November webinar to be able to go over that toolkit and to talk about implementation of this new law. One of the requirements is tobacco-free signage at the school, so that is one thing that schools are going to be working on. And I know a lot of the local lead agencies and local projects have been asking us about how can we help support our schools in doing this. It's a really big concern for our community, and we want to make sure that it happens and that everybody is aware of this new law, and we want to help. So there are definitely ways that local lead agencies can assist, and certainly as part of your Communities of Excellence process, if you are interested in doing this, you want to document that there may be a problem. Because of the way the Proposition 99 funding works, if a school is receiving TUPE money, it's going to be a little bit harder for us to justify stepping in and doing some work, but not all of the schools are receiving TUPE money, so we want to make sure that we're able to assist where needed. So again, making sure to document any problems as part of a Communities of Excellence needs assessment, looking at doing butt surveys, observational surveys, talking with teachers or school administrators about problems. That would be one thing to include in a CX. If a local lead agency does decide that there is a significant problem and they want to prioritize this in light of there not being TUPE funding, about how to help with schools, to do a full-blown objective, it would really need to be quite comprehensive with, examples would be like a media campaign or ads with the schools like on sports calendars, having booths at school events, making sure to attend back-to-school parent nights, providing some of the signage if that is needed, working with a youth coalition to help implement. And then the evaluation would need to be very robust and include some of those observations and butt surveys to show improvement in the compliance. So those are some ways that local lead agencies can work with schools. That example is one that would be for a full-blown objective in a local lead agency scope of work, but there's also options to do some of those activities as part of another secondhand smoke objective. So as always, if you're interested in doing some of that, contact us here at the department and we can help work through that with you. So some of our contact information, both with the California Tobacco Control Program and then also with the Department of Education. If you have questions about the tobacco-free schools implementation, there's wonderful people there who are working really hard to get information out and who are very gracious and have encouraged people that have questions about tobacco-free schools to please give them a call or an email. And now I will turn it over to the Lung Association to continue with community organizing in some of these new laws.
Thank you, Tanya. This is Erin. I'm with the American Lung Association, the Center for Tobacco Policy and Organizing. And I know Diana already kind of covered who we are and what we do. We are a statewide technical assistance and training provider. We do community organizing trainings and policy TA and community organizing TA, so we're here if you need us. In a minute, I'm just going to go over a couple of our new messages around secondhand smoke and secondhand smoke local policy. But before I do that, I wanted to just talk about a little bit about why we organize in the first place and why we do community organizing. And I think this quote from Frederick Douglass sums it up well. Power concedes nothing without demand. It never did, and it never will. And we use this quote because I think a lot of times we forget why we do community organizing, because it can be really difficult and challenging. And sometimes we think maybe it'll just be easier and faster for us to just do it on our own. Let's skip the community organizing part. Let's skip the coalition building part. But really it all comes down to power. And it all comes down really, I think, to this quote, and it summarizes it nicely. Because the reason that we work on policy change in tobacco control and in public health is because the status quo really is the way it is because it benefits those in power in our society. So if the outcomes we desire were beneficial to those with power, then we'd already have them. So if things like secondhand smoke policy didn't help protect people from secondhand smoke, or increased tobacco taxes didn't save lives, we would have no problems passing them. Because those with power on our issue, so the city council members, the boards of supervisors, big tobacco with all of their money and power, they're not going to just give all of that power up because we give a nice presentation or we say the exactly right thing. They're really persuaded by power. And that means that you guys all out in the field have to build that power in your communities. All of this power doesn't come without help, and it doesn't come without our community members. We just can't do it alone. And so we do form these coalitions because together, we're stronger together than we are apart. And so we form these strong, active coalitions that will hopefully help us change our communities. So I just wanted to remind you guys of that it's not, it's not just us delivering a nice presentation as public health people, but it's our coalition, our community coming together, building power, and then using all of these tools and using these messages and using this data that we have and sort of demonstrating our power in the local communities. All right, so again, part of building the power really is these messages, and it really is this information and having all of this knowledge. So we're going to talk a little bit about a couple of new messages that we think are important given these new statewide laws. I've only narrowed it down to 2, but I wanted to you guys keep in mind that all of the other messaging around secondhand smoke still applies. All of the stuff that you guys have been saying for decades, it still applies. These are just the 2 new ones that we have heard from locals, that they have been hearing at their city council or at their board of supervisors. So those are the ones that we're just going to concentrate on today. So, and I actually saw out this pop up in the question box. The state has added e-cigarettes to their definition of tobacco, so we don't need to pass local policy defining e-cigarettes as tobacco. Well, local secondhand smoke laws still need to specifically include electronic cigarettes in their policies. And that's because these new local laws can go further than the state laws, and e-cigarettes will not automatically be included in your local policy. So you have to include them in your local policy. So if you just say tobacco products or you just say cigarettes, that's not going far enough in local policy. You have to explicitly say e-cigarettes in your local policy. And then remember that the best way for local communities to reduce exposure to e-cigarettes, secondhand vapor, or aerosol is to specifically include these products in their local secondhand smoke ordinances. So that's the way that you protect people from that's how you protect people from secondhand smoke and secondhand vapor at the local level, is you include this in your policy. You include this specific language in your policy. And here is the second one. Didn't we just close the loopholes in secondhand smoke exposure in the workplace? Sure, yes, we did just pass legislation that closes many of the loopholes in secondhand smoke exposure in the workplace, but there are still many exemptions. So it's important to remind people of this when you're in the community, when you're talking to community leaders, or when you're talking to your elected officials. Yes, we closed many loopholes, but there are still many loopholes that still remain, both indoors and outdoors. And indoors, that includes, Diana went over some of this, the retail tobacco shops, the long-term health facilities. Those workers are still being exposed to secondhand smoke. And additionally, the big thing to keep in mind is that the state law does not include protections for workers who are exposed to secondhand smoke outdoors. So places like construction sites, restaurants, bars, patios, outdoor events, things like that, those are not being covered in the statewide law. So, and this is really where a lot of you guys are working, right? You're working on outdoor areas. So yes, we've passed this law. Yes, we've closed many, many loopholes that we have been trying and working very hard to close for a long time. But these outdoor protections are still needed. There are still workers that are being impacted. The last sort of message that you should really drill home on is that secondhand smoke should not be a condition of employment. So the best way to protect workers is through specific restrictions on smoking in places of employment, and you can do that through comprehensive secondhand smoke policy, through smoke-free dining, smoke-free event policies, things like that. But secondhand smoke should not be a condition of employment. And that is a message I think that you guys have been saying for a long time now, but it still rings true today. We still have not closed every loophole. Not every worker is protected. All right, so those are just a couple of the new messages that we're starting to hear and that you guys are probably needing to respond to. But again, it's not enough just to have all of the perfect messages. It's not enough to just spout off the statistics or spout off these messages in verbatim. But it's really important to remember that we need to cut through the clutter, because as individuals and as elected officials and as community leaders, we're hearing thousands, probably, messages a day. So we have to figure out how we cut through all of that and get remembered. So I'm going to go over a couple of tips. And the first one is very important. Choose your messenger wisely. A lot of times we work in one community and live in another community. So we're going into these communities as outsiders. We're not constituents of these elected officials. We are public health people. We're truly outsiders. So it's not going to resonate quite as much for us to go and speak to local officials as it would if you have a constituent or a community member from that actual community that would be impacted by your policy. If you have that individual go speak, it's going to go a lot farther than just having yourself speak. It might be difficult to recruit those people, but it's very important that we choose our messengers wisely, because the people that are impacted by the policies really should be the ones delivering the messages. This one seems like a no-brainer, to introduce yourself, but you'll be surprised. Sometimes people get nervous, they go up to speak at City Council, and they completely forget to introduce yourself. So if you are doing a presentation or you're at City Council, be sure that whoever is speaking introduces themselves. And if they are a constituent or you're a constituent of that City Council member, say that. It's very important that they know that you're a City Council member, that you're present, that you're participating in this process, and that you're a voter. All right, the next one. Again, there is a lot of noise out there, and part of cutting through the clutter is sharing a story. This is one way that you can take our messages that we just went over, the data that we have, and make it really personal and make it resonate and be remembered by your City Council members. I can't tell you how many times I've gone to City Council hearings and they don't even look up from their paper. They don't even look at me while I speak. It's really important to try to grab their attention, and one way to do that is through sharing a story. So maybe it is your story about how when you go out to dinner, how you can't take maybe your son or daughter because they're asthmatic and they're exposed to secondhand smoke while you're out to dinner at your favorite restaurant. Or maybe it's a youth going up, a youth member of your coalition going up and talking about being impacted at outdoor community events and not being able to breathe clean air because of the secondhand smoke. So have somebody convey these messages through a story. It'll make a lasting impact on your City Council members. And then keep it simple and brief. Oftentimes, whether it's city council or a different type of presentation, you really don't have a lot of time. 2 minutes at city council, maybe a little bit longer at a different presentation. But you want to make sure that you're not going down a really technical path, laced with a lot of jargon. You're not going to hit every message point on secondhand smoke. That's not the goal. You really want to sort of pare it down, pick 1 or 2 main messages that you can use that are going to resonate with your community or your audience, and use those to help counter any other arguments that you think would come from the opposition, and then convey your message in that way. And always keep in mind the time that you're allotted. You don't want to go over time, so make sure that you consider all of that, consider your time limits before you go and do any type of presentation. And then last but not least, keep it local. We have a lot of data out there, but if you can, drill down as specific as you can. If you have county or city data, use that as opposed to statewide or national data. The more local you can make it, the better it will be, both data-wise and for your stories and the messenger that's actually delivering the information. So keep it local as much as you can. So those are my tips, and that's the quick review of those different messaging points. Again, keep in mind that our old secondhand smoke talking points and messages still apply. And I'll turn it back over to the folks at ChangeLab.
Great. This is Ray Leung at ChangeLab. Thank you, Erin, for that presentation. I just wanted to follow up on, I think the last slide was keep it local. And I know that we do have some data coming up from our Healthy Stores, Healthy Communities work. And I'll just let Tanya, if she can explain a little bit more about kind of that data and when it's going to come out, that'd be great.
Hi, this is Tanya. The Healthy Stores for a Healthy Community data is really mostly about the retail environment, so it doesn't have as much to do with the smoke-free laws. But that data has been returned to counties that have signed the confidentiality agreement, and it is being processed and analyzed and will be released at some future date, probably early next year. So that's what I can speak to for the moment. That's the Healthy Stores data is out there and being looked at by lots of different folks.
Great, thank you, Tanya. If there are, so this is a Q&A, so if anybody has any questions, feel free to submit them through the chat box and we'll go through them. One question that we've got throughout the webinar, and I know that this has already been covered, but the question is kind of why should locals continue to adopt ordinances or amend their ordinances to include electronic smoking devices in their ordinances, in their local laws. And although we've already covered this, I feel like we can't say this enough or explain this enough just because there are a lot of questions that are being asked by health departments and also a lot of policymakers asking this question. So this is really important, as Erin mentioned, because there are a lot of areas that are not smoke-free under the state law, and this could include outdoor dining areas, this could include parks and beaches. And so for areas that for areas that a local community wants to go above and beyond the state law, it's really important for the local community, either the city or the county, to adopt a comprehensive definition of tobacco product that includes electronic smoking devices because the state law just doesn't automatically apply to the local law. So I'll actually use an example that Mary Bell used earlier in the webinar, which is that in this example, you can see the arrow pointing at the outdoor area. The outdoor area is not smoke-free. It's not under state law, but under local law, you could certainly make that area smoke-free. And so to make that area smoke-free, you'd have a prohibition on smoking in that area, and in the local law, you'd also want to specify that smoking is broadly defined to include electronic smoking devices. And I'm happy to answer additional questions if this comes up around why locals need to act, and the center folks as well are more than happy to answer any questions that you have on messaging. And I don't think that there are any more questions, but I'll leave a little bit of time. If anybody has any additional questions, feel free to submit them in the chat box. Okay, I'm not seeing any. Oh, I am seeing a question about economic data. So the question is, this person is aware of economic data from Beverly Hills regarding their clean air efforts in 2010. Has any other community done something similar? Maybe I'll throw this to Erin to see if she's familiar with any economic data.
I am not. I'm sorry. That doesn't ring a bell with me or with Diana sitting across from me. Sorry. I know that study happened, but I don't know. Maybe somebody, Tanya, might have heard if anybody else has done anything like it, but I don't know of anything else.
There may be some available from Los Angeles. I believe they have some economic data, but you'd have to contact the local health department to find out.
Great, thanks. Okay, there are no more questions, so I will just point out as a reminder that our first webinar, which was focused on tobacco sales, is archived online on our ChangeLab Solutions website, so you can go online and view the first webinar if you haven't already. And this second webinar is also going to be archived, and you'll get more information about that in the days to come. And last but not least, I want to thank everybody for participating in this webinar, including all of our speakers. And please, if you have the time, please submit feedback. We have a survey that will be sent to you, so if you click on the link, you'll be able to answer some questions about the effectiveness of this webinar, and we're always looking to hear feedback from everyone who participated, so please take the time to do that. And with that, thank you everybody for joining, and have a good day.